Hi all, it's Dr. Ruth Doughton here. I'm a board-certified adult psychiatrist who uses metabolic and lifestyle interventions to get at the root causes of mental illness. And today we're going to be talking all about how to take control of your mental health. And this is really what I want to be the core message and theme of my channel. I want patients to feel empowered, that they are active participants in their mental health care, and that they have the capacity to make a difference in their own mental health journey. So let's get into it. Too often, people look at mental health conditions, things like anxiety, depression, bipolar disorder, ADHD, as things that just happen to them. And similarly, there's a tendency to engage in mental health treatment passively as your prescribers try out different medications and hope that something provides some symptom relief. Now, don't get me wrong, I don't think that this is the patient's fault at all. You may be doing absolutely everything that your doctor is asking you to do. You're taking your medications, you're going to your appointments, you're making adjustments as needed, you're maybe going to therapy appointments as recommended. And maybe you get a little temporary relief, but after a few months, the symptoms come right back. Or maybe you're questioning if the side effects from the medications are worse than the symptoms that you originally went in for. And I want to be clear that I'm talking mainly about modern day psychiatry here, which is very much medicalized mental illness, and with good reason. Because mental health is a real health condition that contributes to morbidity and mortality just as much as other somatic conditions. However, in an attempt to legitimize itself, psychiatry has fallen into the same traps that the rest of medicine has when it comes to treating chronic illness. And that is, you have a symptom, here's a pill. You have another symptom, here's another pill. Without the consideration that all of these conditions likely have the same underlying root cause, which, as we've talked about in other videos on my channel, is most likely metabolic dysfunction. Now, of course, I think that all of medicine could use reform in this area, but I'm going to be focusing specifically on psychiatry because that's my field. But this is how I end up with patients coming to my office. They're on 6 or 7 different psychiatric medications. They have 5 or 6 psychiatric diagnoses in their chart or more, and they're not sure which one's accurate or not. They come in with poorly controlled mental health symptoms, lots of different metabolic comorbidities, things like diabetes, high blood pressure, obesity, migraines. And they have no idea what medications are helping them. They say they don't have any side effects, but then they're endorsing symptoms like daytime fatigue, increased appetite, restless legs, brain fog, all of which could be side effects of their psychiatric medications. But of course, not necessarily. They could also be related to something else. And it's all just a jumbled mess. Now, what a lot of psychiatric providers might do is just keep tinkering with their psychiatric medication in hopes that something might help. So if this is the current state of psychiatry, how can I take control of my mental health? That's a great question. Now, I think there are 2 important components to this. First is what you do on your own, and second is collaborating with a supportive mental health provider. Both of these components are key. So let's talk about what you can do on your own. First, educating yourself through resources like my channel and others about what really are the root causes of mental illness and what are some of the things that you can do about it. On this channel, we talk all about metabolic and lifestyle changes that you can make to work toward improving your mental health, most of which are separate from, but often best utilized in conjunction with psychiatric medication. These are things like improving your diet, engaging in regular activity, prioritizing sleep and connection with others, eliminating toxins, effective management of stress, addressing underlying hormonal imbalances, and regulating circadian rhythms. Or you may want to go to the next level with the metabolic interventions of thinking about ketogenic therapy or intermittent fasting if that's appropriate. Now, I have a couple of other videos that go into some more detail about these different interventions, and I can link those below. But what if your mental health symptoms are just too debilitating that the thought of even trying to implement some of these changes is just so overwhelming? Of course, that's where working with your mental health provider, and in many cases, psychiatric medication, can come into play. These are resources that can support you and hopefully help to decrease the activation barrier so that it's not so insurmountable to overcome. So this brings us to that second component of working with a supportive mental health provider. Mental illness is not meant to be addressed alone. It's nothing to be ashamed of, and you are not weak if or when you struggle to manage on your own. That's why there's so many psychiatrists, therapists, and other mental health providers out there who are eager to help you. So I would encourage you to find a provider who you really trust and one who listens to you and your priorities and is willing to collaborate with you to achieve your goals. No one knows you better than you do, so don't be afraid to speak up if something about your treatment plan isn't working for you. If, for example, your preference is to not take psychiatric medications, then let your provider know that and have an in-depth conversation about the risks versus benefits of psychiatric medication for you. There may be some cases where the risks outweigh the benefits, and there may be other situations where the benefits outweigh the risks. Your provider may also be able to help you know which areas are the most important for you to focus on and to strategize about how to implement changes that are manageable and sustainable for you. So please feel empowered that you can do something about your mental illness. Your diagnosis does not determine your destiny, and there are plenty of other providers out there looking for patients just like you. Don't attempt to do this on your own. If you have any questions or comments, please feel free to share in the comments below. If you enjoyed this video, please hit the like button and subscribe for more lifestyle and metabolic psychiatry content.